Hey everyone, Dr. FJ. This is Judy, a patient of mine, and Judy's got a really interesting story, so I asked her to tell it. Her son's a chiropractor friend of mine, so he's also an upper cervical chiropractor. So she's coming from about 80-90 miles away to come up and get checked and get adjusted. And she wasn't one of those cases that you know, you get adjusted and all your pain goes away instantly and you feel great for the rest of your life. It was definitely a lot of healing to take place. So anyways, Judy. so when you came up, it was about 2 years ago. It was February of 17.
That sounds right.
Yeah, it would have been a year and a half ago. I was in a car accident August of 2016. Went to a local chiropractor in Racine, Wisconsin, and went to my regular doctor in Racine, and I wasn't getting better. My other chiro released me after, was it like 12 weeks, I think he's the normal standard. And the day he let me go was the day I started going right back downhill, went right back to him. And I guess from what I understand, it was keeping me up. It wasn't actually fixing me. Pain was always bad in my lower back and in my neck. And then in February, in my first hour class, I wound up having a headache that was so severe, I couldn't think, I couldn't hardly even see. And I walked to the office and said, I gotta go. Went over to my regular doctor. We called my son and said, we need to find somebody that I can go to, and he knew Dr. FJ. And so my doctor called up here, and I drove up in a fog and rain with my sunglasses on because the pain was so severe, and spent the whole entire day here. I think I was here until almost 7 o'clock at night. Yeah. I was off for the next 4 days of work, and thus began my journey towards getting better. And it's a year and a half later, and now I'm actually exercising again and actually can do things that I have not been able to do literally in a year and a half. I know this may sound kind of weird, but I can actually put clothes on in the morning without having to hold on to my furniture.
The little things in life.
It's the little things. Like, I can get out of bed now in the morning and walk to the bathroom without feeling like I'm gonna fall apart or wanting a walker. And the day that I could actually put my pants on for work, both legs without holding on to the furniture, I practically jumped up and down, and I was committed to I had to commit to a slower rate of healing than most people would be willing to do, because I won't do pain meds. And so, yeah, without Dr. FJ, as my son said, he said, FJ saved my life, literally, and I believe that 100%, because I would not be sitting here. My regular MD doctor said he doesn't understand why I didn't wind up in the hospital. That's why I didn't wind up in the hospital.
Made me cry.
It's true.
So yeah. In the first visit, is when we did the X-rays. We adjusted. We X-rayed her after the adjustment. I think we had to go through a few adjustments, a few rounds of post X-raying to get it just right. And then the healing. I mean, it takes time to heal, and there was a lot of ups and downs, good for a little bit, and then bad, and then bad for a little while, and then good, but you stuck with it, and it's awesome to see you now, 2 years later, a year and a half later. So,
yep.
So we're gonna go. I'm gonna show you Judy's X-rays, and I'll show you how we check her to see if she's holding or not holding, and then I'll also show you if she is holding, how we would adjust her, and some other things we do too. NUCCA is the foundation, the upper cervical chiropractic. Then we do other techniques and different things to just help the body heal, and help people do better. So yeah, we'll go through that stuff now. Okay, so when we check people after their correction to see if they're holding their adjustment or not, we look at their alignment or their posture 2 ways. One, out of gravity, so they lay supine or they lay on their back, and we check their legs. So Judy, we document everything, so we know when she's out of alignment, her right leg is short by about 3/4 of an inch, and her legs are nice and balanced. She got a little foot flare, so at first you think the right leg is short, but when you take the foot flare out, they're balanced. So the right leg's balanced. So then we're going to check her posture, her alignment, and gravity. Usually when the legs are balanced, you're good to go, but still good double check. So come. So Judy, I'm going to have you stand up facing that way. So you might want to come up.
Oh.
No, you're good. You're
Oh,
good.
okay.
So with Judy, we know when she's off that her right shoulder is going to be real low and her right ear is going to be low as well. And she just drove, what, an hour and a half?
Yeah.
So sometimes with people who come from a long ways, you got to have them rest at first because there's a little fatigue from sitting so long, and you can get a false reading. Here, you might want to. So that's all. We just check. You can see she's swaying a little bit from the fatigue, but her right shoulder is pretty well balanced. You'll make everyone perfect, so that's why it's really important to document where they are when they start. And then you just turn facing me. Let's just see how turn your head both ways and come to center. So, and do it with your eyes closed. Sometimes it can be tricky to tell whether someone's in or out. And are you going to adjust them? Yeah. So she's swaying a little bit, but her right shoulder is pretty balanced. Right ear is a hair low. But she had almost 3 degrees of head tilt, so it's really low when she's off. So we're going to leave her. I just want anyone to see. So when you do the NUCCA adjustment, it's very gentle. You don't feel anything. And if we were to adjust her, I'm going to just have you lay on your left side. So lay on this side.
Oh, yeah, left. The other right.
Slide up just a little bit. So all of this we get from x-rays, and when we do our initial correction, they're in the office for several hours. We x-ray, we adjust, and then we x-ray after to make sure we fix the alignment. Sometimes you got to do 2 adjustments to get people, because when they're on kink, it takes 2 phases to get them where you want them. Other times you get it right away. Some people are really tough, so it's really important to take post x-rays after the adjustment to make sure you're fixing it, you're making it better. But once you fixed it, then you just check to see it holds, you know exactly how to correct it, and there's no need for x-rays unless something changes. We know she's a sharp headpiece from x-ray. We just want to get her neck as relaxed as possible. So I'm not going to adjust her, but if I were, she's 1 1/4 high with no rotation. So I would take her right about there, and I could either come from the side like so, or I do a slight step, come down, slide over, the atlas, come back, and then I would adjust. And the adjustment would look like that, and I would just contract my rhomboids, or you can come straight on, and very gentle. And Judy doesn't feel anything more than a little light pressure on her ear. And depending on how much tension, the adjustment might take 2 minutes, 10 minutes, 15 minutes to clear it out. So that's the adjustment, but she's holding today, and you've been holding for a while now. Yeah, she's been holding for almost 5 months. So now we'll go probably 3 months without seeing her, and we'll check her in 3 months, make sure she keeps holding. Okay, so this is Judy's x-rays. The one on the left is when she first came in. So she had a right head tilt, almost 3 degrees, low right plane line. So the top of her neck, the atlas, was kicked down almost negative 2.416, so almost negative 3/16 of an inch. So her head is just kinked way over, causing all kinds of pressure on the brainstem, muscles, joints, nerves. So in this situation, when you have a low atlas, so the top of the neck has gone low and the head is kinking over it, I always like to take a force straight. So you force the head straight, you measure it, comes out right too. So you know she's right. So then we adjust it, and there was no rotation. We adjusted her, and then that's how it came out. So she went from almost 3 degrees of head tilt to 0.66. She went from 0.9 to 0.79. Lower angle 1.26 to 0.7 the other way, and her plane line came way up to 0.216.
So that's a really nice correction. So you know you've fixed the alignment, but that doesn't necessarily mean you're going to make them feel better right away. You've got to hold them there while the body heals. The nerves, the muscles, the joints heal, and that takes sometimes a long time. For her, she felt, I mean, she was miserable when she came up with her severe migraine. Her migraine was better before she left that day, much less severe, but she still dealt with pain and on and off headaches for a while. And obviously she was, 80, 90 miles away. It wasn't, it's not ideal. She can't always get in every time she needs to right away. So sometimes the body goes out of alignment for a little while before she can get in here. But we were able to, over time, keep her in alignment, get her body holding, and then her body healed itself. And now she's doing so much better. She's exercising again. Yeah, she still has some aches and pains from time to time, but she's 100,000 times better, as she said. So that's what I love about upper cervical chiropractic and the NUCCA technique and orthospinology and AO is taking the post x-rays and seeing for certain that the body, you fixed it. You fixed the alignment. You fixed the posture. The body has to do better. It has to. It's in a better position. It's just a matter of keeping the body there and allowing the nervous system and the innate intelligence of the human body to heal itself. And then also good nutrition, minimizing stress, lots of rest, lots of water. All of that helps the body heal faster. Okay, so we do more techniques than NUCCA. NUCCA is the most important, the foundation of what we do. But then Judy's also been getting some pressure in the back, and we know from previous that she gets some really tight psoas. So we're just going to work on releasing that. So we bring it up, right? It doesn't feel good. Soft tissue work hurts, as you can tell. She's handling this really well. So these just hurt. You got to hold the muscle until you feel it release. They don't usually like to, and it never feels good.
Yoga breathing.
That's right. It does help it release. Yeah, and you can just feel it going, yeah. Yeah, that's better. So we do both sides. So even if the frame of the body's in alignment, you can still have soft tissue-ish problems. That's something Dr. McNally taught me.
It's popping.
And then we'll double check. And we may do a drop adjustment to the tailbone or the low back. Also, flexion distraction, the Cox technique, sometimes we'll do too if there's a disc injury to help those soft tissues heal. There we go.
Ooh.
Yeah.
That was my back.
And the psoas is in pregnant women too. You can get a lot of pain, back pain, and the psoas can be kind of the culprit. And if you don't work on them, you're not going to fix it. Let's have you go face down. Let's recheck. Then we're going to do just a basic sacral leg check. Make sure the hip and sacrum are moving properly. Lift your right leg. Okay, and the left. Is there any pain, tenderness with that?
A little bit better than it was before.
Yeah.
The left one, it popped like 4 different spots.
Okay. Yeah, she's doing good other than that. So you're good.